Welcome to Lecture 5 of Rehabilitation Counseling Theory and Practice 2. We've started in this process talking about the various stages of counseling. We started by talking about establishing the working relationship, which was stage 1. Stage 2 involves assessing or defining the presenting problem. And stage 3 involves identifying and setting goals. Stage 4 focuses on choosing and initiating interventions. Among the various interventions that one can select, today we will be discussing affective interventions, which is part of stage 4. For our class of objectives, we will discuss the role that emotions play in the counseling process, and we'll also describe affective counseling interventions. We'll look at ways to identify emotions, we'll explore troublesome feelings, as well as appropriate feelings and how to assist the client in accepting those. So why do most people come to counseling? The vast majority of persons come to counseling because they are bombarded with overwhelming emotions. Emotions speak to our affect. It speaks to the way in which we feel. And when clients choose the therapeutic process in order to overcome those overwhelming feelings, it's because they have experienced an imbalance emotionally. Sometimes our clients come to services because they are upset about various traumatic experiences or losses that they may have had in the recent days or months. They also come because of emotional disturbances that exist in their daily existence. So oftentimes the primary reasons why persons seek counseling services is because they're dealing with emotions that are overwhelming and that they find difficult to overcome on their own or through their normal social support network. And again, some of the reasons are because of emotional imbalance. They may be emotionally upset or emotionally disturbed. Affective interventions focus primarily on phenomenological therapies, and these are therapeutic approaches that address one's objective realities in comparison to their subjective realities. And what we mean when we talk about the phenomenological approach is there are times in which our clients come in and they have these overwhelming issues that they're grappling with. Sometimes these issues are real, and there are other times when it's the subjective experience that the person is dealing with. It may not be rooted or founded in reality. And so when we work with our clients and we're focusing on affective interventions, which are interventions that are specific to the way in which our clients are feeling, we must differentiate between what is real and what is perceived. That which is the client's objective reality that other persons within their environment would agree to, versus those things that are specific to what the client believes to be real. And as we know, sometimes there is a discrepancy between our subjective realities and our objective realities. Or, putting it another way, there is sometimes a difference between what we as individuals believe to be the case and what is actually happening in reality. And so as a clinician focusing on affective interventions, our goal is to differentiate between the two realities and assist the client in coming to terms with what is real and what is perceived. Carl Rogers is a person-centered therapist that also focuses on affective interventions. And so when we consider the various ways in which we would employ affective interventions, we may borrow some of Carl Rogers' person-centered therapeutic approaches, and we'll talk about that in a little more detail later on. Also, we will focus on Gestalt therapy, because Gestalt therapy is also a therapeutic approach that delves into affective interventions. Additionally, existential approaches, which are those approaches that focuses on humans as rational and goal-oriented individuals, are also part of affective interventions. So as you can see here, when we look at the various therapeutic approaches that take into account one's feelings or the way in which a person feels, these are the therapeutic approaches that come to mind. Again, it's phenomenological therapies, Carl Rogers person-centered therapy, Gestalt therapy, and existential approaches. Already we've talked a little bit about what phenomenological therapies take into consideration. Let's take a moment and just talk a little bit about Carl Rogers and what he espouses as it relates to person-centered therapy. If you recall, Carl Rogers was among the first American therapists to provide the conditions of a humanistic therapeutic relationship. He also proposed 6 counseling conditions that he considered both necessary and sufficient to produce constructive client personality change. Carl Rogers believed that the 6 counseling conditions are: number 1, 2 persons in psychological contact, one of whom was in a state of congruence or integrated in the relationship. Number 2, the counselor experience unconditional positive regard for the client. The third counseling condition espoused by Carl Rogers is empathic understanding for the client. And fourth, the counselors are personally integrated and self-aware. Fifth, the client is valued as a unique person. And sixth, understanding how and what the client is experiencing. And so these are the 6 counseling conditions that are espoused by Carl Rogers person-centered therapy that is believed to be most important in working with clients, particularly as it relates to affective interventions. Gestalt therapy is another therapeutic approach that is very important. If you think about Gestalt therapy, Fritz Perls is the person that should come to mind. He is the father of Gestalt therapy. And Gestalt therapists are best known as holistic therapy or therapist. They believe that the whole is greater than the sum of its parts. It also focuses on the here and now. So Gestalt therapy focuses on the holistic aspect of clients. The empty chair technique is very important, and it also focuses on bringing together all of the various parts of the person so that they can function collectively and holistically. Existential therapeutic approaches are those approaches that view human beings as rational individuals, meaning that we are all striving for the same goals, which are to be meaningful, contributing persons in society. We have the goal to become self-actualized, the goal to obtain education, and to be contributing members of society. And so it's from this perspective that these various therapeutic approaches lend themselves to affective interventions. So let's talk a little bit about what we know or believe about affective interventions. First, affective interventions explore interpersonal relationships, and they're far more interested in the client-counselor relationship rather than techniques. There are many therapeutic approaches, for example, cognitive behavioral therapeutic approaches that focuses on the cognitions as well as the behaviors, and they focus a lot on techniques. And one of the things you'll find with affective interventions is that it's less technique oriented and it's more focused on the relationship, particularly the client-counselor relationship, because it is believed that through healthy relationships with clients, they're able to overcome issues and limitations that exist within their interactions with others. So the counselor-client relationship is one of modeling a healthy relationship that is believed to transcend the counselor-client therapeutic relationship. The other factor that is believed about affective interventions is that one's feelings or affect are most critical and helpful in terms of the counseling process. So it's less about any other issues as it relates to thoughts or beliefs, and it's more about the way in which the client feels. And one of the things you'll find out later is that it's affective, or the way in which a client feels, is not given as much attention in other areas or therapeutic approaches. Also, affective interventions emphasize the emotional context of thoughts, beliefs, and behaviors. So not so much attention is placed upon one's thinking, one's beliefs and behaviors, but far more emphasis is placed on the emotional context, or the feelings associated with the way in which a person believes or behaves. Additionally, affective interventions focus on feelings and awareness. It helps the client to get in touch with the way in which they feel. And one of the things I have found in working with clients as a clinician is that oftentimes clients aren't always aware of how they feel. And there are also some gender differences that separate people from the way they feel. For example, for a man, typically boys are raised to be strong. Boys don't cry. Boys don't express their emotions. And sometimes in the therapeutic process, counselors must assist clients in identifying and expressing feelings, particularly when they've grown up in environments where they were taught to suppress their emotions, or it was inappropriate to feel certain things and express certain feelings. Affective interventions also assist clients in exploration, helping the clients to explore various feelings, the ways in which those feelings impact them and their interactions with others. Integration of feelings is also a very important part of the affective process, helping clients to integrate their feelings, whether good or bad, whether accepted by others or not, helping clients to integrate their feelings within their day-to-day existence, as well as integrating feelings into their thoughts, beliefs, and behaviors. Affective interventions have very specific goals, and all of the goals of affective interventions center around feelings and helping the client to adjust to feelings. When we consider the goals of affective interventions, one of the goals is to express feelings, assisting the client in expressing the feelings. Sometimes it's giving the client permission to cry, or giving the client permission to feel angry or mad or sad about various traumatic experiences that they've had. Other times you're assisting the client to identify or discriminate between feelings. And we'll talk in a little bit, we'll talk about the ways in which we assist our clients in identifying or discriminating between feelings associated with happy versus sad or mad. And one of the things I found in working in correctional settings, particularly with men, I taught an anger management support group. And one of the things that was most compelling to me is that while anger was the tip of the iceberg, oftentimes when you mine deeper and you have more in-depth conversations with clients, underneath the anger is a lot of other emotions. And sometimes you might find feelings associated with fear, sadness, loneliness, abandonment, all sorts of feelings that are below the surface. And sometimes clients feel less comfortable dealing with those feelings. And because, particularly for men and for those that are in correctional settings, they've grown up to identify anger as an acceptable feeling, it's usually the feeling that's most on the surface. But as I said, when you mine deeper, there are a plethora of other feelings that the person is grappling with. And so key to affective interventions is expressing feelings and assisting our clients in identifying or discriminating between feelings. We also assist clients with altering or accepting feelings. Sometimes it's through exploring various traumatic experiences that the client must accept certain realities, accept certain feelings associated with those realities, or there are instances where through processing various issues or traumatic experiences, it assists the client in altering what they once felt with new feelings once they have a more objective understanding of their realities. And that kind of goes back to the phenomenological perspective. Additionally, one of the goals of affective interventions is to help the client to contain or manage feelings. There are instances when clients have to manage their feelings in order to be productive in society, to work effectively on the workforce. And so as clinicians, we have to work with our clients to contain their feelings, to compartmentalize when they are able to feel certain feelings and when they must contain or manage their feelings in order to work effectively and exist productively in society. There are various affective intervention skills, and some of those skills are more basic skills, and then others are more advanced. What I'd like to do now is talk briefly about some of the affective intervention skills that are most likely to be employed in a therapeutic process. First, looking at basic skills. One of the basic skills associated with affective intervention is restating feelings, helping the client to restate their feelings in their own words. So sometimes you might hear a client say, "She makes me angry," or whenever she does whatever, whenever she leaves the toilet seat up, it makes me angry. And rather than projecting one's feelings, it's always important to help clients to take ownership of their feelings. So one example might be, instead of saying, "She makes me angry," one would be trained to say, "I become angry when she does whatever the act is." So it gives the client control over their feelings. And rather than projecting their feelings onto someone else and seeing other people as the cause of certain feelings, it's allowing the client to take ownership of how they're feeling. And one of the ways of doing that is getting the client to restate their feelings by taking ownership. I feel angry when. I feel frustrated when. So it's owning your feelings rather than giving someone else permission to make you feel a certain way, because as we know, no one can make us feel a certain way. We have to allow that person permission to do so. But what we also recognize is certain things may cause us to become upset or angry. Another basic skill as it relates to affective interventions deals with paraphrasing feelings. And when we talk about paraphrasing feelings, that means that you're taking the information that the client is providing you, you're making sense of it, and you're repeating that feeling content to the client, but in your own words. So it's really paraphrasing what the client has said to you, and sometimes it's through words, sometimes it's through actions, sometimes it's through behavior, but you're paraphrasing the information that you're gathering, and you're presenting it back to the client, particularly as it relates to their feelings. And so an example is that you would say to the client, I've heard you talk a lot about your frustration with your wife, some of the anxieties you're associating with being unemployed and having limited income, how it's impacting your psyche and your sense of self. And based upon all of these different feelings and emotions, it's having you very overwhelmed, and it's limiting your ability to sleep and function in your daily existence. So basically, it's collecting that information, putting it into a meaningful, synthesized format, and presenting it back to the client. And sometimes you'll find that the client will acknowledge that that is, in fact, how they are feeling. And at other times, they might say, well, yes, I feel that way somewhat, but I think a better explanation of how I'm feeling is, I'm just annoyed. I'm not really angry. I'm just annoyed. And I'm not anxious. I'm just a little restless. So when you do paraphrasing of feelings, it also, not only does it provide the client with information, it also allows the client to correct us or add additional information so that we as clinicians can have an accurate understanding and appraisal of what the client is conveying to us. There are various kinds of affective interventions that are more advanced in terms of assisting our clients. And so some of the more advanced affective intervention skills involves identifying feelings. And sometimes when we look at identifying the client's feelings, not only must we listen to what they're telling us verbally, but we have to listen to some of the nonverbal cues that they're providing us. We have to look at the body language. We have to listen to the story, and we have to be able to contextualize the situation that occurred, the level of normal emotion that one would evoke in certain situations. So paying attention to one's affect or feelings is a very complex skill that one gains in more experienced client counselor interactions. And you have to pay attention to several different things. It's not just looking at behavior or looking at the fact that the client had alcohol. It's understanding what are the feelings that the client was experiencing, what happened in that argument with the spouse, and what were some of the feelings. Maybe they felt devalued, unappreciated, demeaned, or whatever the feelings are. And then based upon those feelings, what was the outcome? So the important take-home point as you consider identifying feelings is not only paying attention to what the client says to us, because sometimes the client isn't always verbalizing what the issues are. We must also pay attention to the nonverbal information or cues that the client is providing us. And sometimes the nonverbal information is available in the richness of the story that the client is providing us. It's associated with the context by which certain situations escalated. And that's why the relationship is so important here. It's through the relationship that clients will feel comfortable and confident in sharing and disclosing information. And it's also why person-centered approach is so important, because if you don't have a solid relationship with your client, you're less likely to get the rich depth and content associated with what is at the core of the client's problem. So, as we talked about early on in the lecture process, make sure you develop a solid relationship, because it's through the solid relationship that you can only be effective in affective interventions. Without a good, strong, healthy alliance and therapeutic relationship, you're less likely to be effective with therapeutic approaches focusing on the affect. Another affective intervention that is more advanced is looking at one's is a technique known as focusing, helping the client to zone into how they're feeling, focus on the part of them that is feeling whatever the hurt or the sadness is, allowing the client to get in touch with their feelings. What I know as a clinician is that patience is very important with this particular therapeutic technique, the focusing technique. It means that you're slowing down the therapeutic process. You're pacing the process slowly, carefully, and deliberately, and you're allowing the client to immerse him or herself in feelings. What I have learned is that clients have been conditioned to avoid difficult feelings, avoid sad feelings, avoid feelings of loneliness, and so they camouflage feelings a lot. And what's most important in affective interventions is allowing the client the time and the space to focus on their feelings, to focus on their hurts. And so you might say to the client, you know, you've shared with me some very painful experiences about your childhood. And so what I'd like for us to do is just take a moment and focus. Let's just focus on that experience. So if you don't mind, if I can get your permission, I'd like for us just to take a few minutes here and just be reflective. Let's think back to what happened. Let's think back to what was said. Now tell me, in thinking about some of the painful things that was said to you, how did that make you feel? How did you feel when your mother said that you were worthless? What's really important in the focusing technique is being patient and being quiet and allowing the client to feel, experience, get in touch with, and communicate. I know that in this lecture process I'm doing a lot of talking about what happens in this focusing technique, but what's most important here is giving the client permission to get in touch with their feelings. And also, as a clinician, you have to hold back, not do as much talking, and allow the client to do the feeling, experiencing, and talking. And as the clinician, you're doing the listening and the synthesizing. So the focusing technique is very important. It's a critical, crucial technique. It's a very important affective technique, as well as a technique that is most important as it relates to cognitive behavioral therapeutic approaches, systemic approaches. It's also important there. And one of the things I find to be most obvious with new therapists or developing clinicians is they feel very uncomfortable with silence. They feel very uncomfortable when the client is quiet. And so instead of being comfortable with the silence and allowing the client to be in the moment and to be in their feelings, they have a sense of nervousness that causes them to move the client along more quickly. They might ask more questions. They might present options. Are you feeling sad or are you feeling happy? What are you feeling like right now? Are you feeling happy or sad? Rather than simply saying, how are you feeling right now? And just simply allowing the client to express how they're feeling. And then after they've expressed how they're feeling, giving them more time and permission to delve a little deeper. So what I want to say here about the focusing technique is that it's a very, very powerful technique. You have to be comfortable with silence, and you have to be in the moment with the client, giving them permission to delve deeper and being patient with the client. Another important thing to keep in mind is that the focusing technique isn't a technique you want to use when you have 10 minutes remaining in the therapeutic process. When you find that you're running out of time, when the counseling session is nearly over, it's not fair to the client to delve into an emotionally latent situation. So be mindful of the time, and if you're finding that the client is getting into something that's too deep or too rich, and time doesn't afford you an opportunity to really process the issue, back away from the issue so that you can revisit that issue the next session, making sure that you have enough time devoted to addressing whatever the problem may be. And so that's one of those issues that's not necessarily spelled out in your textbook, but that's one of the issues that I know to be relevant as a practicing clinician, making sure that you have the ample amount of time needed to delve into really rich, emotionally latent issues. The focusing technique is among them, so make sure you have ample time. The other thing I want to say before moving on to another technique is that when you find that your client has delved into issues that are very emotional, you owe it to your client to spend time dealing with it, even if it means going over the 50-minute or 60-minute session. It's your ethical responsibility to make sure that your client is intact before you dismiss the client for that particular session. So again, make sure you have ample time to deal with critical issues and techniques that you're employing. Sorting out feelings is another very important affective intervention skill or technique. There are various emotion inventories that are very powerful in assisting the client in exploring their feelings. And so in the next slide, what we'll do is get into some of the inventories. But now what I'd like to say is that one of the things that's most important and that I have found really beneficial when working with clients, particularly clients that have a difficult time with expressing emotions, is doing an emotion inventory at the beginning of the session. And I'm sure many of you have seen the FACES chart. It's a chart with various emotional expressions that are conveyed in different faces. It might have someone smiling, someone laughing, someone mad, someone tense or angry. And so with clients that have a difficult time expressing emotion, or the client they're not congruent, which means that their affect and their demeanor are consistent, it's important to use a sorting technique to understand what the feelings are that the client is grappling with. Also, when I've conducted anger management groups, I've always used emotions inventories or emotions checklists, because it forces the client to understand the myriad of emotions that they're experiencing. And sometimes clients have to be assisted with understanding the full gamut of feelings that exist out there. They're used to the very simplistic, basic ones: happy, sad, mad, lonely. They are not in tune with the vast amount of emotions that exist. So when I've taught anger management courses or support groups, emotion inventories are also always very critical, because it helps the client to get in touch with various emotions. And oftentimes we're not feeling one emotion. Usually, for us as well as our clients, we're feeling multiple emotions simultaneously. And our goal as a clinician is to help the client to understand the various emotions that they are experiencing at any given time. The other important skill is to help the client to have role reversals as it relates to their feelings. As I've mentioned before, sometimes clients are most accustomed to those feelings that they believe are most socially acceptable. Remember, we talked about the phenomenological perspective that deals with the objective reality versus one's subjective reality. And there are times within one's subjective reality, they believe that it's only appropriate to show a particular emotion. For some people, it's you must always be happy. You must always wear a smile. Even when things are very difficult or painful, you must also always wear a smile. And I've especially seen this with some people. They might be crying, but yet they have a smile on their face. And you might could think back to people it might be friends or acquaintances, and you could see tears streaming down their face, but at the same time they might have a smile. And so it's helping clients to get in touch with their emotions and not to feel like they have to wear a smile when they're hurting inside. A lot of addictions are associated with a person's inability to feel feelings that are difficult. And so because they want to avoid feeling those difficult feelings, they want to soothe the hurt, they want to get past the hurt, then they camouflage those feelings or they band-aid those feelings by drinking alcohol or taking other substances. And when you have a client in the therapeutic process, what's important is to help them to get in touch with those feelings. And role reversals are important interventions to help the client do that. So you may ask yourself, what is a role reversal? So let's say, for example, the client might come in and they are upset about something that happened at work or something that might have happened at home. And so they come in and they're talking about a coworker that they had a disagreement with because the coworker was hogging the payphone, knowing that they needed to use the payphone. So they're just really upset because of the coworker who violated their right to use the phone. So as the clinician, and we talked about the Gestalt approach, and this is where Gestalt approach comes to life in affective interventions. And we know that with Gestalt therapy, it deals with the empty chair technique. And when you think about the empty chair technique, it is the prime opportunity for role reversal. So what you would do is you would allow the client to get into the role of the person that they're angry with. So you get them to switch roles with the person that's on the payphone. And you say, now tell me what issues or feelings might be going through the head of the person that's on the payphone, the person that is the object of their anger or frustration. And what do you think will happen when a client puts himself in the shoes of someone else, which really also goes back to Carl Rogers' empathy. See, not only must we as counselors have empathy, we must teach our clients to have empathy. And so in this process, through the process of role reversal, you're teaching your client to have empathy, to put him or herself in the shoes of someone else. So when you say to the client, tell me what you would be thinking or feeling if you were in the position of your coworker, that allows them to think about what's going on in the mind of the coworker, what feelings they might be going through. Like, for example, the person may say, well, my coworker that's on the telephone will say, you know, I was here first, I waited my turn, I'm on a very important call, I had to wait, thus you must also wait. This call that I'm on could be life-threatening, it could be extremely important. And so what happens in that moment is it puts the client in a position where they step out of their own reality and they step into the reality of someone else. And by doing it, they have a broader perspective of what the issues are, what the concerns of the other person. And so in this process, they're going from their own subjective realities to a more objective reality, seeing beyond the confines of their own views in that moment. Role reversal is very important. Another skill that's also important in affective interventions is the alter ego exercise. And so what is the alter ego exercise? We all have an alter ego. We have that ideal self that we would like to be. You know, there's that part of us that might have, for me being a female, there's that little girl within me that is sometimes shy and intimidated. And assisting your client in enhancing their alter ego, allowing that person to enhance the parts of themselves that might be a little shy or intimidated. And sometimes it might be just the opposite. Maybe the alter ego might be this bulldog that's really out of control and dogmatic and insensitive. And an alter ego exercise might be putting the client in a situation where they have to calm themselves, that they have to let the top dog take a back seat and let the underdog take the front seat. So it's allowing the person to use the various parts of him or herself to arrive at the place where they would be most functional and beneficial. So with the alter ego exercise, it's connecting the client with the various parts of him or herself. And who best can tell us about who the alter egos are than the client? When you really get to know your client, you will learn from talking with them, not only from their verbal but from their non-verbal cues, what the parts of their alter ego are. And once you understand what they are, you can assist the client in identifying those parts of self and conducting exercises with those various parts of self. The empty chair exercise is something I briefly touched upon within the confines of talking about skills when I talked about Gestalt therapy. And sometimes with role reversal, you might use the empty chair technique. And sometimes you may not. Sometimes you just get the client within their same seated position to say, okay, now what I'd like for you to do, Johnny, is to switch in the role of the person that's on the phone. You've done an excellent job telling me about how you felt about what your coworker did to you. What I'd like for you to do right now is just take a couple of seconds and get into the mindset of your coworker that's on the phone. And for a few minutes, I'd like for you to be the person on the phone and tell me what's going on in your head while you're on the phone. And so what happens in role reversal is the person could be in their chair and be in the exercise. They don't have to switch from the chair they're seated in to another chair. What's powerful about the empty chair exercise is that it's something unique about moving from one position to another. Most offices have 2 chairs within the office setting. And so there's, of course, the therapist is in her seat, the client is in a chair, and there may be another chair, an empty chair. And so with the empty chair, you get the client to either be in various positions of self. They might explore the different parts of their alter ego, like maybe the top dog might be in one chair, and then when they become the underdog, they might move to the other chair. That's one way in which the empty chair technique can be used. Another way in which the empty chair technique can be used is when the client is talking to his or her parent. Let's say the client has a parent that they're really angry with because of something that was done in their childhood years. And in this situation, the client would envision that their mother or father is sitting in the empty chair, and they would talk to the empty chair as though that person were the mother or the father. So as you can see, the empty chair technique is very powerful. It has the potential to evoke a lot of emotion, particularly when the client is feeling safe. One of the things that's important, and I've seen my students do the empty chair technique when they have to try out different therapeutic techniques. And with the empty chair technique, sometimes they will stand on the side of the client and coach the client as they're going through the empty chair technique. And that's very important, where you, the therapist, is in that moment. Sometimes in the empty chair technique, it's always better to, instead of being in the client's periphery, to sit slightly behind the client and talk to them. And you might say to them, now, tell your mother what you've always wanted to say to her. You wouldn't be on the side because you're in their visual space. And sometimes by being in their visual space, you can kind of take them out of their therapeutic mode. And so it's important to get just behind the client so that they're facing the empty chair. You are just behind the client, and you're saying by coaching the client, now I'd like for you to say to your mother what you've always wanted to say. And so then what you might also do in that moment is get the client to be in the position of the mother. And so you might say, okay, so what would your mother say to you after you just communicated your feelings to her? What that does is, by putting the client in the chair of the parent and expressing the parent's emotions, is, again, it allows the client to see issues from the parent's frame of reference. And you know, for many of us as adults and as parents ourselves, you know, we understood things from a certain perspective when we were children. And now that we are adults and we are parents, for some of us, we're parents ourselves, our reality becomes totally different. And the way in which we understood our childhood may be different, because now we sit in a different position and we see things differently because we are seated in a different position. So the empty chair technique allows the client to try on different issues, points of views, and perspectives through using the empty chair. Sometimes the client may serve as the other person. Sometimes the counselor may serve as the alternate person. So maybe the counselor might be the mother, and the client will be the child communicating to the mother. And so there are various ways of role playing. The empty chair technique is one, very powerful. I encourage you to read more about the empty chair technique because it's a very, very powerful technique, especially when you want to explore various realities. And as we said before, affective interventions are really about exploring different realities, particularly from an emotional or an affective perspective. Another way of using affective interventions is through using dreams. Some people argue whether dreams are factual, whether it's a part of the subconscious or the conscious, but the fact of the matter is it doesn't matter. It's using the content for the here and now, and that's what's really important with Gestalt therapy. He uses dream work in the here and now. It doesn't matter if it's real or perceived, whether it's factual or not. It's using that content in the here and now and allowing the client to draw meaning in the present as it relates to whatever the dream was. So for example, if the client had a dream about running from a pack of wild dogs, as the clinician you would say, so tell me how that makes sense for you. How do you think your dream relates to who you are right here and now and what you're experiencing, or to your daily existence? How does this dream relate to where you are currently in your life? And then the client might say, sometimes I feel like I'm on this treadmill and I can never catch up. I have so many demands that are tugging at me. I have the kids, the husband, the career. I have aging parents, and so I feel like I have all of these things chasing after me, and no matter how hard I work to get ahead, I feel like I'm just a few steps away from being overwhelmed or taken over by all of these demands. And so that's just one example of how the client would use a dream. And in that example, it was a dream of the client being chased by a pack of wild dogs, and how that situation parallels to their present day life experiences, and allowing the client to glean some richness from that experience and to move beyond where they currently are, the feeling of being stuck. And lastly, another affective intervention skill is emotive imagining. And so the imagination is a very, very powerful tool. And if you think of the imagination, I know I love reading books. And what's beautiful about reading books versus seeing a movie is that in your mind's eye, you can create so much more detail, so much more fantasy. You can allow the mind to take you in some very powerful places. And so in using one's imagination, you could allow them to experience feelings of happiness, of sadness, of getting to the other side of a difficult experience. Maybe you can have them envision a tunnel, and they're going through this tunnel, and through the tunnel represents some of the most difficult experiences that they've had yet. But as they get to the end of the tunnel, they start seeing glimpses of light, different color hues that are coming through the tunnel, which symbolizes getting to the other side. And what it means to get to the other side of pain or sadness is usually all of the arrays of colors and of light. And so helping the client to envision images that provoke moving from where they are to where they would like to be. A lot of times therapists use the ocean because the ocean represents a place of peace and tranquility. And so whatever the place of peace and tranquility, you're using images to foster evoking those different emotions, to move the client from their present emotional state to where they need to be. So as you can see, affective interventions are rich with therapeutic skills and approaches. And at the core of affective intervention lies the relationship. The relationship is front and center and at the very core of everything you would do as an intervention, as an affective interventionist. And I'm a firm believer, no matter whether we are affective interventionist or whether we're cognitive, behavioral, or family therapist, in our perspective, systemic in our perspective, the relationship is at the very essence of what we do as good clinicians. And research clearly shows that more important than techniques or therapeutic frameworks, the relationship is the essence of what we do as clinicians.